if you're a woman dealing with stubborn back pain, or you feel like your core just isn't firing the way it used to, or you're even getting some hip tightness, well, there may be a missing puzzle piece that you haven't figured out yet in order to solve your problem once and for all. My name is Dr. Dawn Andalone. I'm a pelvic floor specialist and physical therapist, and your pelvic floor may be the key sign that your back is not getting better with all the conventional methods that you've tried. Maybe you've seen a chiropractor, maybe you've gone to a physical therapist, maybe you've had massages, or you've tried all these stretches and exercises, but you're having some lower back pain, even hip tightness, or your core muscles just aren't working the right way. So your pelvic floor muscles can actually be a key factor in order to help your lower back. And these symptoms are often missed and misdiagnosed because this area and the missing link with these muscles haven't been properly treated. Most people assume your pelvic floor is just having to do with bladder leaks or any kind of intimacy issue, or sometimes your hips. But did you know it's actually the bottom part of your core and your stability system? And if it isn't working properly, then that whole system is not going to support your spine and affect your movement, your strength, really of your whole trunk. So those pelvic floor muscles are more important than we give them credit for. When your pelvic floor is too weak or too tight or too tense, we're going to compensate in other parts of our body, and therefore you're not going to be able to move as freely, you're not going to be as strong and stable. So it really does have a big effect on your whole body. You're going to compensate in areas of your back, your hips, your posture, your breathing, and all of that is going to lead down the road to not being able to really get to the root of the problem and solve it 100% and get back to the activities that you really want to be able to do. So in this video today, keep watching because we're going to talk all about how these pelvic floor issues can lead to back pain and create this long-term dysfunction in your body, and what you can do to actually solve it and get it better for good. So the pelvic floor plays a bigger role than we realize. It's really that bottom part of what makes up your core. So you have this whole system that needs to work together like a canister. And the top part is your breathing muscle, your diaphragm, and the bottom part of your core is your pelvic floor muscles, these muscles in red. And then you have your deep abdominals and your lower back muscles that attach to your spine. So in that system, if you're having back pain, you're having any hip tightness that's unresolved even after stretching, or you're getting symptoms of pressure, heaviness down there, bladder leaks, anything like that is a big red flag that something is off within that whole core system. So we like to address how the pelvic floor muscles are working, because if they are weak or they are tense, that is actually going to create a problem with that whole system. And oftentimes it does turn up as back pain that doesn't get resolved. So common issues caused by pelvic floor dysfunction. Number one is back pain. Pelvic floor that's too tight or too weak is going to compensate, and therefore your spine can't work the way it needs to work, and your spine should be stabilized, but it should be mobile, and therefore those muscles need to do their job in order to support the spine. Now, if it's not working, it's going to lead to lower back pain and stiffness. It can lead to poor posture, chronic instability, or even the pain that just persists, even creating some pressure problems with your discs and your lower back as well when that whole system is unbalanced. So number two is hip and SI joint pain. Your SI joint is that area in the back here where your spine, your sacrum, or your tailbone connects to your hip bone. So in that sacroiliac joint, it's very common for women to get pain there, especially if they've had children in the past and that area is held together by ligaments. But having the stability of the pelvic floor muscles can really provide a lot of support, because your ligaments, they stretch, and your ligaments don't have good blood supply. So the more strength you have around your hip muscles and around your pelvic floor to really support that area, you're going to have less hip pain and sacroiliac pain, and even problems such as sciatica can be a limiting source because something is going on with those pelvic floor muscles and they're not able to really support your pelvis in the best way. So you start getting that numbness, tingling, pain in the area in your buttock and down the leg as well, with uncomfortable sciatica symptoms. So number 3 is core weakness and disconnected abs. So the lack of support from those deep ab muscles, they're not going to work as well if your pelvic floor isn't doing the right thing. So you can work your abs all you want, but it starts from the bottom up. And if you don't have support of the pelvic floor, then oftentimes even a lot of the postpartum women that I see may be having an abdominal separation, diastasis. It comes with back pain. And if we work on the pelvic floor to connect with the deep muscles in your abs, all of that system is going to work better together. You're going to feel even more ability to contract your core, use those muscles to feel stronger when you're lifting things, and also be more toned through your midsection when your inner muscles are working the best way with your pelvic floor. And number 4, postural imbalances. So your pelvic floor being that support through your hips and your pelvis. When you're sitting and your pelvic floor muscles are really tense and you're sitting back on your tailbone a lot, that is going to lead to less ability to support your spine and also a lot of tension and tightness in your hips. You may notice rounded shoulders, a tucked pelvis, even forward head posture. All of that, if we don't have a supported system with your pelvic floor muscles, then it affects your posture all the way up the chain. Alignment and posture being so important in Pilates exercise, which is what I teach. Having that support of your pelvic floor, that's where your good posture starts. So this has a ripple effect to affect your hips and affect your lower back if your pelvic floor muscles aren't doing the right thing. So oftentimes people that do spend a lot of time sitting back on their tailbone, they have more issues with bladder incontinence or prolapse or lower back pain because they're not in alignment. So they're not over their sits bones and their pelvic floor muscles can't work the right way. So working on your posture goes hand in hand with your pelvic floor muscles, and when those muscles are working properly, you're actually going to sit up taller, have better posture, and use those muscles more appropriately for your breathing and getting your core stronger. And then number 5 is a big one, breathing dysfunction. So a tight pelvic floor does restrict breathing of your diaphragm. Therefore, you're gonna have more shallow breathing. You may get more tension in your neck and shoulders because of that. But going back to doing some diaphragmatic breathing exercises, I have a great program for that with my pelvic floor Pilates program. I'll link down below. But learning how to do breathing exercises and some basic core activities and exercises that incorporate your pelvic floor will overall calm your nervous system, allow your back pain to go away because you'll be able to breathe in a better manner, which helps your back muscles relax. And then therefore, it's going to help that whole system work better. When you're breathing properly, your core is going to fire better and it's going to support your back even better too. So breathing being one of the most important types of exercises in order to work on when you are having back pain, and a tense and tight pelvic floor is not going to allow you to breathe the best way. So we want to work on that together to help those pelvic floor muscles go back to a more rested state so they can support your spine and support your pelvis in a better manner. This, you may notice that you're subconsciously just breath holding when you're concentrating or when you try to lift something or when you're just under a lot of stress and pressure. So stopping to take slow, deep breaths in through the nose, out through the mouth, and focusing on getting that air down in your belly, down in your pelvis, rather than breathing from up here can do wonders for your pelvic floor. So any signs this might be affecting you is if you've had this persistent lower back pain or hip pain that with traditional methods or seeing other practitioners it's not getting better, then it could be a sign that your pelvic floor is part of this too. Now for women over 40, I often see bladder leaks or any complaints of urinary urgency and having any of those uncomfortable symptoms or feeling like they're just disconnected from their core. That is also part of why your back is hurting. It's other clues that your pelvic floor could be part of this missing link that if we solve that, your back pain will go away and that hip tension and tightness will also be relieved as well. Then the next thing that you can do is getting support of someone that can guide you in the right direction with looking at what your pelvic floor muscles are actually doing, and checking in with a pelvic floor physical therapist can be a game changer. And working with someone that's going to give you some coordinated exercises. So learning some basic exercises with how to relax your pelvic floor, but then also how to contract it by using your core muscles all together as a system. So not just learning how to squeeze your pelvic floor, that's not what I'm talking about, but we want to be able to learn how to relax those muscles, and then therefore they can support and work when they need to work and support your back in a better way. So have you ever considered that your hip or back pain may be related to your pelvic floor? Comment below, let me know if this is you and if this hits home and you have learned something from this video. Would love to hear from you. Now, if you haven't already, I'll put the link below to book a call. I have some special programs that can definitely help guide you in the right direction and help you feel more confident about getting over this back pain once and for all and having the right types of strategies and exercises. If you haven't tried it, it can be a game changer. So thanks so much for watching this video, and I hope to see you again in another one soon.